We're here with Dr. Tye with Family Tree Dental. And Dr. Tye, it's interesting. We talk a lot about dentistry and people think about cleanings. And then there's the tougher part. I got to get a root canal. And then we're going to need someone to kind of get that root canal covered, get it fixed. And that's really where you come in. The interesting thing about a crown, people for years have thought, okay, I'm going to have this big gold tooth in the back and, sometimes it'll fall out. But man, technology has really come a long way, hasn't it?
It has. It's come a real long way. So a lot of the materials that you historically think about with crowns would be things like gold or silver or something very metallic in nature as far as what it looks like aesthetically. But nowadays there's a whole host of options when it comes to crowns, from porcelains, ceramics. There's even some metallic products out there that you would never guess were metal by looking at them, like such as zirconia, that behave in a way where you get all the strength of metal, but all the aesthetics of porcelain.
You gotta have something that sits properly and fits properly. How quickly is something like that done? If I was to come into your office and had the root canal, what's the process of getting the crown on?
It's a great question. So a lot of times, whether it be, a lot of people think about crowns in conjunction with root canals, right? So they always think, oh, if I need a crown, then I must need a root canal, or I've already had a root canal. First of all, that's not always the case, right? So crowns are almost always done with molars after root canals because it strengthens the tooth and prevents the fracture, but it's not always in conjunction with a root canal. But in this case, if you had a root canal and you came to the office and you're looking to get a crown done, it's going to usually be about 2 appointments in most cases. That first appointment, we're going to shape and prep that tooth to receive that crown. And then we're going to take an impression or a digital scan of that tooth when we're done so that we can have a custom fit crown. Every crown's made to fit your tooth and your tooth alone. So it's going to look good, the size, the shape, the contour, all of it's going to fit well in your mouth when we're done with it. That's that first appointment. We'll finish that first appointment with a temporary crown. And that's just meant to get you through that first 2 to 3 weeks while that permanent crown's being fabricated at the lab.
That's pretty incredible. And the other thought is, okay, well, I've got a crown, but there are some cases where someone's going to need a bridge. How does that determination get made, and what happens?
Yeah, that's a great question. So with a bridge is very similar to a crown, but it's more of a multi-unit crown, right? So where a single unit crown would go on one tooth and it's only going to affect one tooth, and it only really addresses the restorative needs of one tooth. A bridge can be used to replace multiple teeth, usually between 1 and 3 missing teeth in a single quadrant of the mouth. And so when we talk about, who is the ideal patient for a bridge, you're looking for somebody who perhaps has a whole quadrant of their mouth, or perhaps multiple quadrants, where they are not only missing teeth, but they may have other teeth in that same quadrant that are in various states of disrepair or have cavities or fractures. And so the benefit of a bridge is that you can have, if you have a missing tooth with a tooth in front of it and a tooth behind it that perhaps has a large filling or restoration in it, maybe one that's starting to fail, or perhaps has a large cavity or fracture in it, you can crown both of those teeth and then have a replacement tooth for the tooth that's missing in the middle. And it's bonded together as one unit. So you can think of it as kind of a 3-unit crown with a artificial tooth in the middle.
Dang, it's absolutely incredible that there's so many different options I can have, because let's be real about it, when we're talking about bridges and maybe some crowns, I'm a man who likes to eat. I'm a big man, for crying out loud, right,
Sure,
Dr. Tye?
Sure.
So I don't want to miss a step, but I mean, it's important not only for pain, but I mean, someone's got to eat.
Absolutely. And that's part of the beauty of a bridge, is it helps restore not only aesthetics, but it restores function to areas of the mouth that are missing teeth. And it does so in a way that it's a lot more natural than say a partial denture, or certainly more than like a complete denture. And so it's a great way to be kind of restored back to normal or to full function without having to go through maybe a surgical procedure that, perhaps an implant would require.
Well, I tell you, here at Family Tree Dental, it's a great name. Because you guys really are family, but you and your brothers have taken it to another level. I mean, do you're like, hey, let me just go work with my brothers. There's 3 of you that are in the practice.
Yeah, there's 3 of us in the practice, and it's fun. It's just a good time,
Yeah.
It's hard to look at it as going to work every day when you get to work with family.
Yeah. Well, man, you guys are absolutely fantastic, because the time we've worked with you, something I've learned to appreciate about Family Tree Dental is you guys just aren't in the dental business, medical business. you're in the people business.
Absolutely.
You guys are very relationship oriented, and I love that about you.
Yeah, I've always felt that, I've been interested in dentistry for a long time, and it's been a passion for me. But I've always felt that I became interested in dentistry because I was interested in people first.
Yeah.
And I'm glad to hear that shows through.
No, it does. It does. Well, Dr. Tye, thank you so much. Fantastic.
Thank you so much.
Our dental team would love to answer your questions and provide the solutions you're looking for. Contact a Family Tree Dental near you.